The essential components of a Frisbee throw involve the entire body. Learners need to have a strong background on body rotation and wrist movement to create force production. A Frisbee throw involves very little muscle usage, however, the learner's stance is important. A strong squat-like stance is important to create permanent maximum support posts, allowing easier rotation of the hips. The biggest improvements found during my training session is between my pre and post tests, with my skill level over 3 times as good from trial number 1 of my pre-test to trial number 3 of my post-test. I have slightly skewed results in the retention test section, which should have been lower values. This could have been due to the break of practice sessions for over a week during Thanksgiving. Overall, my results were positive between the pre and post tests due to many practice sessions, demonstrations, and augmented feedback given by my peers. My results for the transfer test were next lowest following the pre-test, showing that my skills for the transfer test were not transferred from my learned skill. I believe this is due to my level of vision of the targets, which were transferred from the floor to a person standing. When the person was standing, the target seemed a lot closer, hence my throws landed very short. Or in this case, completely off the track. My biggest coordination change was my wrist movements. During the pre-test, my wrist was not tight to the body, sloppy, and lowered too soon prior to release. During the post-test, my wrist was tight to my body pre-throw and remained straight throughout the release of the throw. We concluded that the ideas used in this project could be used in a professional rehabilitation setting, such as an occupational therapist or a physical therapist. First, rehabilitation workers could use augmented feedback as well as demonstration to have patients perform rehab exercises to their best abilities. Next, PTs and OTs could use skills such as time scheduling and goal setting in order to create the most effective, timely rehab schedule for each of their patients.